A patient today asked about Lamictal or lamotrigine and its use in bipolar disorder. Lamictal is a medication that is FDA approved for bipolar maintenance. And what that means is that if someone is in a euthymic state, so euthymic state means that they're not in a depression and they're not in a hypomania or mania or mixed state. So if someone is in a euthymic state, when this medication works well for someone, it will prevent them from falling into depressions or prevent them from going up into a mania or hypomania. Lamictal is a very commonly used medication. Many individuals prefer this medication to other mood stabilizing medications because it doesn't tend to have the weight gain that some of the other mood stabilizing medications have. It doesn't tend to have sexual side effects that some of the other psychiatric medications have. And it doesn't tend to require frequent lab draws or lab draws nearly as frequently as some of the other mood stabilizing medications that are out there. With that being said, it is a medication that does have side effects, and it can have some serious side effects. And in particular, there's an autoimmune phenomenon that some people experience with this medication, where if they start it, and they're vulnerable to it, or if they start it and the dose is increased too quickly, it can cause an extremely serious and potentially fatal rash called Stevens-Johnson syndrome. There's also a very serious skin condition called TEN, or toxic epidermal necrolysis, that can happen as well with this medication. And so when someone takes this medication, it's incredibly important that if they develop a rash of any kind, they stop the medication and see a mental health or a medical professional immediately to make sure that it is not Stevens-Johnson or TEN. It can also cause a condition called aseptic meningitis, so basically meningitis that's not caused by a bacterial infection. And so if an individual on this medication or when titrating this medication develops stiff neck, sensitivity to light, nausea, vomiting, or other symptoms, it's important that they stop the medication and see a medical professional right away. But those are relatively rare side effects. They can happen, so you need to know about that if you're going to take these medications. But in general, Lamictal is actually one of the medications that I'll start a patient on first for bipolar disorder maintenance, because in general, for most people, it tends to have a very well tolerated side effect profile. If you believe this video pertains to you in any way, please be sure to reach out to a mental health professional to set up an appointment. The information in this video is just informative only. It's not meant to be medical advice for anyone out there.